Hi, it's Bobby Watson with Texas Impact. We are here on week 2 of COP. I am here with Dr. Abi Oluyomi with Baylor College of Medicine, who works on the intersection of health and climate. Dr. Oluyomi, can you talk to us about your work?
Thank you. So my work generally looks at how places where people live, where they work, affect their health. And in that regard, climate, of course, affects the environment and it affects places where people live and work. So that's how I'm interested in the relationship between climate change and health and how I work in this area.
Can you talk a bit about what you're doing here at COP29 and what you're kind of looking for?
Thank you. So here, this is my third COP. I've been to the last two COPs, and I noticed, of course, from my own experience at the COP, and also from the delegations and the deliberations at the COPs, that health has recently become a focal issue and a key issue in the deliberations. So since then, I've been coming back, and that's one of the reasons why I decided to come to this particular COP, because this week actually somehow is supposed to be like a health focused week as well. So I'm here to see what other people from all over the world are doing, what they're saying about the relationship between climate change and health, and also to hear about solutions. Well, first of all, to actually hear about understanding the problem and also hear about solutions that are being pursued by state agencies and NGOs and even the research community in terms of areas of focus. So that's why I'm here.
Thank you so much. Can you talk about some of those problems you just identified, like disasters or air pollution? What are those
Yeah,
problems?
thanks. So because climate change ultimately affects the weather and it affects the amount of heat that's in the atmosphere, we know that those kinds of situations and circumstances affect the weather pattern and it affects how, for example, the the number of and the magnitude of disasters. That's a well-known fact. There's enough evidence to show that disasters in general are increasing in strength and they're also increasing in numbers. So that's one way by which climate change affects health. And because it affects disasters, and we know disasters have direct relationship with health outcomes in the immediate aftermath of a disaster and also over a long-term period, right? So there's that part to the problem. There's also the problem of, for example, you mentioned air pollution. We know that the causes of climate change, which essentially not the only cause, but a major cause of climate change is greenhouse gases in the air. And we know that a primary source of greenhouse gas is emissions from fossil fuel, right? So the same processes that are involved in the conversion of stored energy into fossil fuel in terms of production of carbon energy also creates pollution. That's also well known. So we have air pollution as an after effect of that process, and we know that it's also driving climate change. So one way to think about the connection between climate change and air pollution and energy production is the fact that if we decide to, as a global community, minimize the amount of carbon-based energy, we can do two things. We can address air pollution on one hand and also help mitigate the effect of climate change. So I think that's part of what these conversations are about at COP in general that are happening among states actors. So yeah.
Can you talk a bit about now some of the solutions? What is the health community doing to address these problems and climate change?
Thank you. So the point about that, one of the things I like to say is the fact that the health community as a whole, as an entity, we're concerned about the effects of climate change on health. So we raise our voice, we present, well, we do the research to first understand the relationships, how climate change either directly or indirectly affects health. And we bring the findings to places like COP or other places, right, to talk about what we are seeing in terms of the effect of climate change on health. For example, we talked about disasters earlier. So when we have disasters across the globe, we got, I mean, no matter where you go, we're now seeing that the effect of disasters on health go beyond immediate injuries because people, may be affected by debris or flying objects to mental health. So mental health is becoming a big part of how climate change or disasters affect health. And when we talk about mental health in that regard, we're not just talking about the immediate stress that people feel, but long term, we're seeing that over many years, people are still having mental health effects from disaster experiences they had years before. So when we see those kinds of evidences, if you will, from research as a community of people in health, we publish the papers, we report, and then we also bring that to places like COP. Right now, on the flip side, the health community is not necessarily well positioned to actually change the causes of climate change, right? So that's more of industry sort of space, but we can still talk about how climate change affects health to motivate people that have the wherewithal and the energy to make those changes in terms of preventing causes of climate change.
Thank you. That's super informative of what's really going on and what people are doing. Last question: can you just tell us what you hope comes out of COP29 and these negotiations?
So, because like I said earlier, health is gaining more ground in COPs in general and in climate change negotiations. So it's sort of a new, I don't want to say, it's a new phenomenon, if you will. And what I hope personally comes out of COP29 is the elevated sort of status for health in all the deliberations. In fact, I would hope that at some point, no matter what the work group is within COP, or no matter what the thematic area is within COP, that health becomes a cross-cutting sort of issue, right? So whether you're talking about let's say, biodiversity or economic development in terms of financing and all that, that COP actually, that health is cross-cutting, right? So that's one thing that I think personally I would like to see. The other one, of course, is the fact that when it comes to health in general, and especially now we're talking about climate change and health, the people that are most affected across the globe are people living in developing economies where resource poor settings, and that's actually made the discussions about financing solutions to the health problems we're seeing because of climate change a thing at COP. And I was at a session yesterday where they talked about how do we best do this, because there was a World Bank delegate that explained the limited amount of money that goes into solving or addressing health problems that are being caused by climate change. And I believe what it said was that only 0.05% of the money that's basically being provided by the World Bank for adaptation end up going toward health focused issues. So they acknowledge the fact that it's a limited amount of money and we need to do a better job of providing enough financing. But beyond financing, because financing at the end of the day usually is loan but we also need to think about grants and money that may not become burdensome on the states that get the resources. So those are two things that I think I would like to see come out of COP is
Thank you so much, Dr. Oluyomi. We'll come back here with more information later.
Thank you.